Hi there, it's Lisa from the Nipawin Area Family Resource Center, and today I have Megan Kovacs from Melfort. She is a labor and delivery nurse, and will be doing our presentation here for us today. Welcome, Megan.
Thanks, Lisa. Thanks for having me again. Hope to share some information of what to expect while you go into the hospital to have your baby. So, like Lisa said, my name's Megan. I've been a nurse at Melfort Hospital for 8 years now. Do a mix of things in rural nursing, but one of the things that I do and enjoy doing is maternity and delivering of babies. Um, I teach with the U of S also for the College of Nursing. Some things we'll talk about today are packing your bags, when to come to the hospital, what to expect when you get there, different positions you can use for laboring, pain management, what to expect for the actual delivery, and what to expect after for postpartum expectations as well. So packing your bag might vary a little bit depending on what facility you go to, but overall, I think this is pretty comprehensive. So you could bring snacks, anything that you may want to eat, either during labor or after. Some facilities might have a fridge that you could put it in as well. Bring comfortable clothing and footwear, baby wipes, clothes for baby, any personal hygiene items that you may want for yourself, lanolin if you are planning to breastfeed, and formula if you have a preferred brand and are planning to formula feed. You could bring your vitamin D drops, any prenatal records if you have them, and a birth plan or wishes if you have those as well. Also, don't forget your car seat. Supplied things, usually there's pads, underwear, diapers for baby, any pre-hospital medications that you might have been on are usually provided while you're in hospital, meals for mom, and then some formulas are also available. When to come to the hospital will kind of vary depending on where you are and also where you're planning to deliver. So if you do have a bit of a drive, obviously you'll want to start heading out sooner rather than later. If your water breaks, though, you'll want to go in and be assessed. Same thing with decreased fetal movement or bleeding. Intense abdominal pain would be another reason to go in. Once your contractions are every 5 minutes, lasting 1 minute for about an hour, that would be a good time to definitely start heading, and that would be if you're kind of closer. There's a great app called Contractions. It's very simple. You can start, stop the contractions. It'll show you how long in between, how long they last. Other reasons to come to the hospital, if you're scared or if you think you need something for pain, those would be good times to go. When you get to the hospital, you'll have to register, so you'll need your health card. Then you'll head over to either the antepartum unit or a labor and delivery unit, depending on which hospital you're going to. You'll be assessed by a nurse typically. So we would listen to baby's heart rate, check you over, listen to your blood or check your blood pressure, your pulse, your temperature. We might ask for a urine sample. And then depending on what's happening, we may check your cervix to see how things are progressing. Then we let the doctor know that you are there. They may choose to come and assess. Sometimes we just continue to monitor and update them as needed. And then I think most facilities now have like a doctor on call system versus the doctor that's actually been following you. So you might not see the doctor that you had seen in clinic. So there's multiple different positions that you can use for laboring. Here's just a few. So one of them is hands, knees. That can kind of help open the pelvis and allow baby to come down. Throne, it's a nice seated position. You're still able to be in the bed, but it is using gravity to help bring baby's head down as well. Side lying you can use. They have it with the stirrup in this one. And then there's also birthing balls and peanut balls that you can use. And here is an example of the peanut balls. So they can be used to help baby down through the pelvis and also can help reposition to some degree as well. For pain management, so there's medicinal and then non-medicinal. So if you're looking at the non-medications, bath, shower is an option. They work well depending on your facility, what's available. That you can use the different positions and the use of the balls. You can listen to music, use other distraction techniques, pressure points or counter pressure. I've seen some moms come with a comb and they like to hold the comb in their hand. Um, Massage can help, and breathing techniques. For medications, each medication kind of has its time and place. So depending on where you're at in the labor, and what your wishes are and what is available at your facility, I guess, would help determine which medication you could get. So morphine is usually given as an injection. It's used early on in the labor. Fentanyl is a little bit closer to when we're going to be delivering. And that one's usually given IV. Antonox is the gas that you can breathe in, so it's usually a mask or a mouthpiece. You have control over that. So when you're breathing in the gas, you have the effects of the gas. As soon as you take the mask away from your face and breathe the normal air, then the effects of the gas are gone. And then we can also do epidurals. So most facilities now do a walking epidural. So even though you've got an epidural, you can still get up and walk and move around. Typically, you won't have a catheter if you're unable to void. Sometimes we may do like an in and out catheter just to help with that. But I think that having the catheter all the time has kind of gone to the past. And then another option is a pudendal block, and that is blocking nerves in your pelvis as baby's coming down. And that one is used later on. Okay, so now you're fully dilated, and what happens? So we'll confirm that you are, in fact, fully dilated. We'll notify the doctor, set up the room for delivery. So that includes us setting up our sterile field and also checking over our baby warmer to make sure everything's ready for baby. And then often, even though you're fully dilated, it doesn't necessarily mean that we're ready to push. Babies can still be quite high up in the pelvis, so we allow time to labor down. And that means that your body naturally brings baby down, so it helps to decrease push time. Once we're ready, though, it's time to push. So for effective pushing, we'll push during contractions. So when a contraction starts, you take a deep breath in, push down into your bum, hold the air for a count of 10. Usually the nurse or the doctor will count down for you. You could take a nice deep breath in and push down again. You can have multiple pushes with each contraction. As long as that contraction's still there, you can keep pushing. After the contractions pass, though, then you take a break and get some nice deep breaths, and relax, have a drink of water, and wait for the next one to come. There's a lot of different positions that you can push in. There's a few shown here. If there's something that you're passionate about trying, just mention it to your team. They may make recommendations also depending on how things are going and how you're pushing or how baby's positioned. Lots of women are scared of pooping, but if you poop, you're actually doing it right. And we're really good about getting rid of everything, and no one will even know what happened. Okay, so now baby is here. The head's delivered, and we'll ask you to pause, not to push at that time. And that allows baby to turn into its position to exit the pelvis, and then the doctor checks to see if there's a cord around the neck. As the shoulders are delivered with the next push, you'll get a medication called oxytocin, and it is either given as an injection in your leg or IV, and that medication helps your uterus to contract to reduce the risk of bleeding after. And baby is delivered, placed skin to skin on your chest. The cord is clamped and cut at about a minute of age. and you may have your support person do this. Just notify us ahead of time so we know that that's part of your plan. Usually we do some dry and stimulating a baby to get them to cry. We listen to their heart rate. And then if everything looks good, we leave baby on your chest. If we have some concerns, then we may need to cut the cord sooner and move baby over to the warmer. After that, the placenta is delivered, and then we are doing your vital signs and checking your flow and feeling your belly to see if your uterus is contracted every 15 minutes. You stay we stay in that frequency and in that room, depending on what facility you're in, for about an hour. During that time, if there's a repair, then the doctor does that. We'll give you a quick wash up, give you a pad and some underwear, do a head to toe assessment on the baby. Babies routinely get a vitamin K injection, and that helps to prevent bleeding as they're not born with enough vitamin K, which is a clotting factor. And then some facilities are not routinely doing the erythromycin eye ointment anymore, so you may not see that. After all that, we give baby back to mom and help you if you are planning to breastfeed. And then, like I said, after that hour, we may move over to a different room in Melfort you do. And then it's snack time. We'll feed you after all that hard work. So postpartum care and expectations. After you move over to your room, we do still come check on you quite frequently. The frequency does decrease as the time goes on, but we check on you more at the beginning. We're gonna check your blood pressure and your heart rate, make sure that you're not having any pain, make sure that your amount of bleeding is normal, you're not having any large clots. Um, we can give you medications for pain management after. There's a tub bath and a shower that you can use. And then we also offer assistance with breastfeeding. So when will you be discharged depends on a few things. Does seem in the last few years people are wanting to go home sooner. Baby's bilirubin isn't drawn until 24 hours of age. So if you choose to go home and everything looks good and the doctor discharges you before that 24 hours, you will have to return to a hospital to get that blood drawn. But other requirements before discharge is that the paperwork needs to be completed. Baby's cord clamp may or may not be removed. Most facilities are doing a hearing screen and a cardiac screening before you go home now. And then there's some discharge teaching that needs to be completed. And we include things like making sure that baby's getting enough milk, monitoring for postpartum depression, family planning, infant safety, recovery for you, expected output for baby, how to clean and care for the cord. And then once you are discharged, public health follows up with you once you're at home, and usually you follow up with your family doctor within 1 week. So the fourth trimester is the first few hours to days after you've had your baby. And it's an important time to take care of yourself as well. So for caring for yourself, things to consider is that you may have some uterine cramping. So it might feel like a period cramp or like a mild contraction. And what that is actually your uterus shrinking back down to its normal size. So it can be uncomfortable. You can take Tylenol and naproxen, have warm baths to help with that discomfort. And then you may have some vaginal pain as well. You can use ice or Tylenol, naproxen, warm baths, and rests. If you've had a C-section, you may have dissolvable stitches or staples. You can only shower for 6 weeks, no baths, and then you have to monitor for infection as well. Diastasis recti is separation of the abdominal muscles. You may have heard of this before. If you haven't, that's great. Usually it does resolve on its own within the first couple months, but you can see physiotherapy if you aren't seeing any improvement. and your doctor can help you set that up as well. Urinary incontinence has been normalized as something to expect after delivery, but it's not something that you have to live with. So again, seek help from physiotherapists and your doctor to regain strength to your pelvic floor muscles. Breast and nipple discomfort. Breastfeeding can be difficult. Poor latches can lead to cracked nipples. If you use products like lanolin before and during your feeds, that will help. You can also express breast milk onto your nipple and allow air to dry that, and that will help prevent cracks. The lanolin is safe for babies, so you don't have to wash it off before you feed. And if you're struggling to get a good latch, reach out to public health and or a lactation consultant if you have one in your area, and they're great resources to help you. So like I said, you want to make sure you're having tub baths regularly, eat nutritious meals, drink water to fuel your body and milk production and to avoid constipation. Your flow will continue to decrease and it turns from that bright red to pink and then clear. No strenuous exercise or heavy lifting for 6 weeks. It's recommended to avoid sexual intercourse and using tampons for 6 weeks. And often the first few days, your emotions can seem quite overwhelming. But if it lasts longer than a few days, you should reach out to a loved one or a healthcare professional like a public health nurse or a doctor to discuss that. And then caring for your baby. So until baby's cord falls off, then we recommend that you only do a sponge bath every few days. So usually 7 to 10 days that cord will fall off, and then they can have an actual tub bath. Babies don't need to be bathed every day. They're not getting dirty. And if you bath them too frequently, it does dry their skin out. So that's why we recommend every few days. Until that cord does fall off, you're going to clean around the base of it with a Q-tip with water on it, and then a dry Q-tip. And just watch for signs of infection like redness, if there's any discharge, smell. It should be continuously getting dry. Jaundice is yellowing of the skin. It can be normal to see it to the whites of the eyes or the tip of the nose, but if you start to see it on their chest, then that would be something to follow up with your doctor about too. Jaundice is a buildup of bilirubin, and bilirubin is excreted in the baby's poop. So the more you feed, the more they poop, the less likely jaundice. You could put Vaseline on their bum and that helps to avoid rashes. Also helps, the meconium is the first few poops they have and it's like tar. So if you use Vaseline, then that helps to make cleaning up easier as well. Feed baby every 2 to 4 hours or whenever they're cueing that they may be hungry. Babies should have at least 4 pees and 2 poops a day. If not, then you need to increase how much you're feeding. You could swaddle baby or rock baby for comfort. You could do skin to skin to help bond and increase milk production. And dads can do skin to skin as well. Safe sleep includes sleeping in a bassinet on back with no blankets or toys. And then usually they'll get their first set of vaccines around 2 months of age through public health. And that's everything. Thanks for listening.
Thank you, Megan.
Yeah,
I
you
was
bet.
just wondering, that app you mentioned, do you know what that app looks like that we can share with families? I just
It's
went
literally called contractions. I'll see if I can show you on here.
I went for a quick look on the App Store and there's quite a few different ones. So I was
Yeah,
wondering which is the one that you
it
recommend.
is. I don't know if I could show you here. It's red and it's got like a little heartbeat on it.
Okay.
And it's called contractions. Contractions timer.
Okay.
It's
Perfect.
one of the simplest ones. There's a magnitude, and I think they all probably do the same thing. But it is nice because when you come in, you can show us that, and it'll show us how much time in between, and then also how long they are.
Awesome. Thank you. Because I was like, oh my gosh, there's a lot more than I thought there was. So that
Yeah.
helps. Perfect. Well, thank you, Megan.
Yeah, you bet. Thanks for having me, and hopefully I'll see some of these moms in Melfort one day.
For sure.